Hi, I'm Rebecca Overson with Lake Prenatal Massage, and I'm going to talk to you about Diastasis Recti, which is a common occurrence in most postpartum women after you give birth. And what that means is it's a separation or a widening of the rectus abdominis muscles. So if you think about somebody who has a six-pack, has defined abdominal muscles, or even if you don't, you probably know there's kind of a little valley in between where those two muscles come up like this. When you're pregnant, everything stretches out and it widens, and it's really common for women to experience a thinning of that tendinous sheath that keeps those muscles together. After you give birth, you can check yourself for it to see if you have that separation, and there are specific exercises that you can do that will help to close that gap. I always tell my clients why it's important to close that gap is because if you plan on having more babies, that's only going to get worse as you go. I've had some clients on maybe 4th or 5th pregnancies that have such a severe separation that their skin is really thin and the tendon, their abdominal wall is really thin, and it just makes it harder for your body to keep the baby in a good position. Those are people that you see whose bellies are really hanging far forward out of their pelvis. So it's really important for anything that you do, for your posture, coughing, sneezing, anything like that, just for your general overall health, to make sure that you rehabilitate your core muscles after you give birth. So let me show you really quickly how to check for yourself, and then if you want more information about how to close that gap, just give us a call or send us an email, and we're happy to give you the information about our classes about that. So basically, if you just lay yourself down on your bed or your table, and just lay nice and flat, and if you just bring your chin up to your chest, and then place your fingers above your belly button. If you can feel, and I do actually have a separation, so you can see, I don't know if you can zoom in there, but you can see that I can actually feel in between those muscles there that there is a gap. I can even fit 2 fingers in right above my belly button. And sometimes when you pull your chin up to your chest, you'll even see a little, like a bulge outwards, and that's an indication of a diastasis. You can even go down all the way and just see how far it goes, but that's my belly button, and my separation goes from here up to about here, and it's about 1.5 fingers wide now. I've been working on it. So anyway, check yourself, and let us help you pull that back together.